why marketing and communications, why does it even matter in building a culture of health? I think the simplest way to really respond to that is it informs, it influences, and it engages individuals. Expanding that definition and really looking at the science, health communication and social marketing practices use behavioral and social science theories and models to influence audience attitudes and behaviors to improve health. So today's topic is not going to focus on the theories and frameworks and models, but just to know that there are stages of change within that model is a very applicable element. Motivational interviewing is also very common to communication, especially around patient or client employee-oriented communications as well. So why does it matter? Communications and marketing is critical in promoting the value proposition to organizations and participants. We need verbal and written and even more. Communication modalities have really expanded, especially in the last 10 years, but they're important to improve health through influence and impact. And it has to be part of a strategic communication plan. I think sometimes individuals who are working in the space of employer health and well-being, workforce health and wellness programs, they connect the communication elements, but perhaps not on the personalization or maybe not as part of a broader organizational plan. So just like anything dealing with the mission and vision of a health and well-being program, as we look to the culture of health, it has to be really part of the system. When health communication fails, programs exist, participation doesn't. We just think, oh, let's just send more emails, let's send more messages, let's get some posters, but maybe not always the right vehicle in which the message needs to be shared. I always love the story where the EAP program was promoted at the time clock. And so as these blue collar employees would stand in line as they wait to clock out, not a single one of them had recall of if they even had an EAP program, and not a single one had recall that there was a flyer poster at the clock out. Is it something we do? We believe in, we support, but at the end of the day, if the participation isn't there, is it really the intention? Who's really responsible for those as well? The graph is looking at a health risk assessment. And so this is dated, but what it really focused on is that when you have very high communications, so you have multiple methods of communicating to individuals and employees to participate in a health assessment. So as you increase the dollar amounts on the bottom, and once you get to $100 with elevated multiple modes of communication, you will reach 70%. But you will only reach about 45% if you only have one or two methods of communication. The high was at least 4 methods of communication to really try and get individuals to participate. If you can double the communication methods, you will more than likely double the engagement as well.
The point you're making here is really powerful, and that is that with a mature communication and marketing plan, you don't need nearly the same amount of incentive dollars to get people to engage. When we talk about communication and marketing, it may be 80% marketing and 20% communication. And so marketing is the why and communication is the what. You're not going to get anywhere with people unless you're really highlighting the why.
Signals became my framework as I was putting together the different elements that are so critical and important for marketing and communication. The S stands for strategies before tactics. You really want a strategic framework. It takes the coordinated effort of reaching individuals and helping them understand both the need and opportunity to improve health. So having that strategic operating plan is really what drives relevance. So when exploring the type of communication and marketing strategies, it's important to address 3 elements. Are the communication and marketing messages relevant to the audience? Was the target audience involved in providing the insight into the preferred strategies? And number three is the population segmentation is also critical to ensure that the message is tailored to the specific needs of an individual or group. Generationally, we're very different in how we like messages. So the importance here is surveys, focus groups, making sure we're looking at data points like claims, utilization reviews, capturing stories and lived experiences. Leadership is our loudest channel of communication in the workplace. Individuals will not change behavior unless they really believe that trust is supported. So it's wonderful when you have a wellness program, but who's going to show up to your diabetes education program if they're not supported by the organization because they don't have time off? Systems don't change if leaders don't model the way. Culture doesn't shift unless people believe they belong. So really, it's more than awareness. There's the different levels of communication. Awareness is just getting the word out. Action is really where the behavior starts changing and ultimately the culture change too. So moving on for signals, the N is norms and networks. Change is contagious. Behavior change spreads through social networks, often up to 3 degrees of separation. We don't change in isolation. We change in environments that support us. One message does not fit all. Again, looking and reviewing health literacy, cultural relevance, the population segmentation. And then one of the parts of A for audience and adaptation is we would always do focus groups. So in addition to our surveys that would really collect more of the quantitative information, we really wanted to ask employees like, what are your top health issues? What do you believe and perceive as the top health issues? Where do you get your information from? The internet, the printed materials, family and friends? I know folks are using AI. Is it a physician or healthcare provider? Is it your health plan? How do you want to learn? And for most people, it was group settings. Some liked one-on-one, some liked the internet, or again, kind of virtual, some types of virtual platforms. Some people still like reading actual print materials. What are individuals' barriers to actually either engage in programs or change behavior, lack of motivation, lack of time, perhaps others, and then what motivates individuals. And at the end of the day, a lot of motivators are really their family. One individual quit tobacco and he would take his $10 a week, which again, this was a few years ago, if you think about tobacco and the cost today. So it would be probably $50+ a week, but put it into a savings account for his grandchild who was then, 2 years old. And when he turned 18, this individual messaged me and informed me that he had enough to pay for his grandson's college, which was just a remarkable story. So from campaigns to culture, it's always intriguing when there is a wellness program and we message that we have this amazing program, but by the way, your leadership is sending emails at 9 o'clock at night and sometimes asking for a response. The scope of a project expands, deadlines shorten, meetings run late. We want you to be well and healthy, but yet your culture of the organization is not really saying or speaking those terms. So these are the 3 different metrics in health behavior that we really look at and measure. So process, metrics, impact, and outcome. So when signals align, there's improved satisfaction, participation, engagement. The impact is the improved in the health, lower health risk, clinical measures improve, and the outcome is the improved overall quality of life, cost containment, and alignment with a mission. So just in summary, marketing and communication are strategic health interventions that shape meaning, norms, trust, and behavior, not just awareness. Evidence shows engagement requires more than incentives. Leadership, relevance, repetition, and social influence matter more. Effective communication is a data-informed, human-centered. Quantitative data tells us what. Qualitative insight tells us the why. Leadership is the loudest communication channel. What leaders model, support, and repeat determines what becomes culture. Sustained impact requires layered, consistent outreach. It takes sometimes 10 messages to reach one engagement. Culture does not change through programs alone. It changes through what people see, hear, experience, and share every day.